We want to give a welcome to everybody who is connecting from California or from other locations across the country or in other location. I will remind everybody a few house rules at the beginning. This webinar is going to be recorded, and the webinar is going to be available also after the data today. So the recording of the webinar will be posted, including also the question and answer time, to make it available offline in an asynchronous way. So we are starting the recording now, and I'm very happy to welcome everybody this morning for this webinar titled Understanding the New Normal, Activity and Mobility Patterns of Low-Income and Disadvantaged Communities in the Era of Hybrid Work and High Gas Prices. My name is Giovanni Circella, and I'm the director of the Three Revolutions of Future Mobility Program at the University of California, Davis, and also professor of mobility at Ghent University. And we are very happy today, all of us from the Institute of Transportation Studies at UC Davis, to have this webinar in which we will discuss research that has been carried out by our research group in ITS Davis that discusses really how low-income disadvantaged communities members are adjusting their activity mobility patterns in these times of big transition and disruption in the transportation sector. And I'm very pleased to be joined today by two of our great researchers in ITS Davis. Maria Carolina Lecompte is a Ph.D. student in the Transportation Technology and Policy program, and she has been carrying out a lot of the research that will be presented today. And Dr. Basar Ozbilen is a postdoc researcher in our group in the Institute of Transportation Studies at UC Davis, and working on this project together with several other projects and assisting Carolina in this research. I also want to acknowledge two other team members that are not speaking today, but have been also making a great contribution to this project. Vanessa Alvarez Reyes is also a student at UC Davis in our group working on this research. And Young-Soon Lee, Dr. Young-Soon Lee is the co-director of our Three Revolutions Future Mobility Program and has been making great contribution to this project. And we thank all of them and all the other researchers at UC Davis, in the California state agencies, in all the community-based organizations, and all the other partners that have been helping and supporting this research. We will have an initial presentation during this webinar, and Basar and Carolina are going to be speaking for the initial section of this webinar. And then after that, we will have some time that is reserved for question and answer. At the bottom of the screen, you can see a Q&A button. You can post your question using that feature in Zoom, and we will pick questions at the end of the webinar, but you're welcome to post already your questions anytime during the presentation, and we will monitor the question and answers, because if there are some clarification questions, we might answer them during the presentation at the moment in which the question is raised. But if there are general questions about the study, we will answer them in the question and answer time at the end of the webinar. With that, I don't want to take more time to introduce this webinar, and I will pass it first to Dr. Ozbilen. Basar, please, let's start our presentation, and we very look forward to hearing the results of this research. And for all the people connected online, again, please don't be shy, post your questions, and the speakers will be very happy to answer to you.
Thank you so much, Giovanni. As the postdoc lead of this project, I was supporting the efforts from Carolina, who has been leading the project so far. So here you can see the outline for the project. So Carolina will give the initial introduction for this project with some literature review about the disadvantaged communities. Then I will be chiming in regarding the parts related to the larger mobility project that has been used as the basis for the interview project that will be presented today, and present some findings from the quantitative analysis that we conducted before we started doing this project. And Carolina will take over again, and she will present the methodology and the findings from this project. So at this point, I would like to give the floor to Carolina so that she can kick off the presentation.
Thanks, Basar and Giovanni. So to begin, a brief introduction and literature review on the project. So just to get everybody in context, the project objectives was to expand on and complement existing larger behavior study that we were doing here at 3RFM in UC Davis, this time focusing on in-depth interviews to members of low-income and disadvantaged communities. And we wanted to understand the challenges of how low-income and disadvantaged communities have had the following new experiences in terms of private and work activities, also availability of travel modes, their changes in living costs and gas prices, and perspectives on new mobility options and solutions. So just a brief context of what we saw here in California. In general, there was a decrease in transit services and slow recovery of these. And we know about the financial cliff that there was all over the country. Also, we know that there were greater options for hybrid and flexible work for many people, but not everybody. And there was a greater use of information and communication technologies for shopping and telehealth. And so that were things that maintain and are still available. And we all experienced increase in gas prices, which also led to inflation and other costs and greater costs in other products. So a little bit about equity and inclusion that we based our understanding for this project was knowing that transportation can affect people's accessibility to different places. There's also a disproportionate distribution of benefits and burdens that we know of. We know that people of color especially bear greater burdens and in terms of transportation related to exposure to road accidents, emissions, and lower accessibility. And also here, with a great proportion of the population being Hispanic Latino, we know that there is particular accessibility challenges associated to language barriers and immigration status. And that was what we came to the study with. Other things that we already know is that the California Environmental Protection Agency is the leader in terms of how to evaluate disadvantaged communities. And we understand that there's a big tool of CalEnvirScreen that considers a lot of indicators to score and determine which communities are more burdened and disadvantaged. Of course, this considers ideas in terms of environmental pollution, other hazards, and exposure to other environmental issues, and also areas with concentrations of people that are low income, high unemployment, low levels of home ownership, a high rent burden, and lower levels of educational attainment. Other indexes also consider low income and racial and ethnic indicators. And this is what we started to consider, what we could, based on our survey, what we could use to measure or identify the participants. So other things we know about how people were traveling in terms of post-COVID and how low-income and disadvantaged communities were traveling. We knew that those that depend on transit were greatly affected by reduced services, also like the financial aid for transit agencies, and subsequently the discounted fares that were temporarily provided are in many cases already back to normal or higher prices. Also, that a lot of the low-income and disadvantaged community people don't work in jobs that are remote, like health, retail, restaurants, and driving and logistics, construction, and others. So these are jobs that are likely not to be enabled with hybrid or flexible schedules. Also, in those that are car-dependent households, they have experienced the higher gas prices and do not have other options to use. So now I turn to Basar, who will explain a bit of the mobility panel project.
The project that is being presented today is a qualitative project, and it's the extension of our larger mobility panel project that has been conducted by the 3RFM group since 2018. To be able to understand the travel preferences and mode choice behavior of individuals within the state of California and also in other states of the US, we started two survey studies in the pre-COVID period, one in 2018 and 2019. When the COVID-19 pandemic hit, we were analyzing the results of these two studies, and to be able to understand the changes in the travel and activity patterns of individuals due to disruptions caused by the pandemic, we decided to start collecting information from individuals who participated in the previous waves, so that we have the ground for the comparison for the pre-COVID behavior and during COVID behavior. So we conducted two surveys in the earlier periods of the pandemic in spring 2020 and fall 2020. And after the limited stay-at-home orders were lifted by the state of California, we introduced the summer 2021 survey, which was an extension of the early period surveys of our mobility panel project. And spring 2020, fall 2020, and summer 2021 data collections have been considered by our group as during COVID data collections, while the 2018 and 2019 were the pre-COVID studies. Once the US government lifted the COVID-19 related public health emergency, our team decided to introduce a new data collection in the fall 2023, which is also the basis for the current study that we are presenting today as the post-pandemic travel behavior of individuals. Can we move forward with the next slide, please? When we talk about different ways of data collection, it's important to talk about what kind of panel structure we are talking about. So in this slide, you can see the sample sizes for different waves that were included into our larger mobility panel project. The blue bars here represent individuals who have been recruited for the very first time in the corresponding wave of the survey. The dark orange one, or the dark orange bar, is representing individuals who participated in a previous wave and who have been recontacted in the corresponding wave of the survey. And you can also see the light orange bar here, which is representing the individuals who did not participate in the corresponding wave. I would like to make one clarification here. An individual who is not participating in a corresponding wave does not mean that the individual dropped out of our mobility panel project completely, but rather they participated in a later wave of the survey. So in this panel structure, we have individuals who participated in 4 or 5 different waves, but we also have individuals who participated only in 1 or 2 waves of the survey. And here you can see the entire sample size that we have for different waves. Next slide, please. So when we talk about different ways, it's also important to highlight a few things regarding distribution channels that have been used for these surveys. And as you can see, we have a rich set of distribution channels that have been used in different ways. For example, in the most recent wave, post-pandemic 2023 wave of the survey, we used all the distribution channels listed here in this slide. So if we briefly go over these, the first channel, the longitudinal panel, includes individuals who have been recontacted after taking an initial survey and agreeing to participate in a follow-up study. We also included individuals as the first-time recruitments through a market research company called Qualtrics with their opinion panel through the online survey completion. We also had the convenient sampling in which we collected information from individuals through some social media channels or our connections with the community-based organizations who were willing to coordinate with us to increase our sample size, especially from the disadvantaged communities. When it comes to the last two, mail-in, mail-back, and mail-in online, these two printed surveys have primarily focused on oversampling individuals from the equity tract, the tracts in which we have a higher percentage of disadvantaged communities or low-income individuals. So that with the third, fourth, and fifth data collection channels, we tried to increase our sample size from the disadvantaged communities. Next slide, please. So since the 2023 wave has been used for the selection of the interviews that have been included in this survey, we are presenting the in the study, we are presenting the data set for the 2023 wave only here. And you can see the sample sizes for different channels. Even if we did our best to collect as many responses as possible from the disadvantaged communities, it's important to underline that the collection of responses from disadvantaged households was much more challenging as compared to middle and high income households throughout the survey period. Next slide, please. So before we get into the findings related to the interviews, I would like to briefly talk about our descriptive findings that relate to the survey data we have, so that we can inform some of the later findings that we confirmed with our interview study. So with the descriptive findings, we only analyzed during COVID and post-COVID survey waves that have been presented in the previous slide. So we mainly focused on understanding the remote work behavior among low-income workers, the access to private vehicles among individuals from low-income households, and the financial challenges that these individuals have been experiencing during and post-pandemic periods. Next slide, please. So we first look at the nature of job and perception of technology among the low-income individuals. So we found that throughout the survey period, we saw a lower share of jobs that allow doing remote work among the low-income workers. And that was the case also in the poll 2023, meaning that about half of the jobs that were done by the low-income workers did not allow working remotely. And this was compared to the middle and high-income individuals, this was a quarter of the other group. And for that reason, we saw that in terms of their perspectives about remote work, low-income workers had a higher percentage of people saying working from home is not a practical option. We believe that this is likely because of their limited space in the household, but also because of their limited financial resources. Next slide, please. So we also looked at the access to cars and attitudes towards different travel options among the individuals from low-income households. 1 in every 5 low-income respondents had no access to private vehicles of any form. And when we compare this with their counterparts in the middle and high-income households, this was substantially lower. And not surprisingly, for these individuals, for these respondents in the low-income households, a car was just a way of getting from one place to another. So they were mainly focusing on the functionality of the car rather than the brand of the car. Even if the respondents from the low-income households were using public transit much more frequently than their counterparts in middle and high-income households, we did not find more positive views among these respondents. So they did not express more positive views about the use of public transportation, about the cost efficiency of public transportation. And that was somehow surprising for us, but it also showed us that even if they are using public transit more, this is not a choice, but more like a necessity for respondents from these households. Next slide, please. So when we finally look at the economic hardship and life satisfaction among respondents from these households, we found that about 70% of low-income households were concerned about meeting basic needs. And this was consistent across different waves of the survey. So we found that they were consistently more concerned about meeting their basic needs, which was about twice as high as those of the other households from the middle and high income. And when we look at the life satisfaction, we also found that consistently respondents from the low-income household had a lower life satisfaction. Even if this increased in the post-pandemic period as compared to during pandemic as presented in the slide, we still have lower life satisfaction for individuals in these households. Next slide, please. So all in all, I would like to conclude my part about the key findings from the quantitative analysis based on the survey data. But please note that these are all explored further in the interview part of this presentation. So the first finding is we found that for among the low-income workers, the jobs that they have been doing were not allowing them to work remotely as much as their counterparts in the middle and high-income households. So this did not only put a higher risk about virus exposure to them during the pandemic, but even in the post-pandemic period, this is reducing their flexibility in organizing various duties at work and in the household. For that reason, it's important to promote flexible work arrangements, especially among individuals from the low-income households, because this lack of flexibility is impacting them negatively. The second one is about the practical, about their perspectives about different transportation options. As I underlined, low-income respondents hold a practical view of cars, but they are not necessarily supportive of funding public transit more. So this is showing that the service quality or the frequency of public transit is not considered as high quality among the low-income respondents. For that reason, improving the service quality is important, but also this showed us that with the interviews, we should understand what are the reasons behind such a view about public transit among low-income respondents. So lastly, when we look at the challenges related to meeting basic needs, we see a consistent issue among the low-income households, showing that they have a lower life satisfaction, they have higher challenges in terms of meeting their basic needs. For that reason, it's important to understand these challenges better and providing mobility options to respondents in these households so that they can maintain a good economic condition and a higher quality of life. At this point, I would like to give the word again to Carolina so that she can extend these findings further with the interview data we have.
Thanks, Basar. So I'll continue with the methodology we approached for the interviews. So we learned a bit the literature review, and we based our sampling frame, or found our sampling frame based on the respondents that agreed to be recontacted from the survey that we just learned about. Interviews took about 20 to 30 minutes, and each participant received $25 gift card. Then we proceeded with the transcription using AI conversion, and in this case, we used the script. Then we verified those transcriptions and then proceeded to include them in vivo for further theme coding and analysis of the respondents. So a bit of the focus here. So we focused only on California, and this is from the subset of people from California in the survey that Basar just presented. I won't go into detail here, but after we found those respondents, we did an initial pilot sampling frame of 30 emails, selected only of the 50 or less income, considering the different literature. So we began with that and found that some of the respondents here did not identify, not all of them, but half of them didn't mention a lot of their challenges. They were okay or semi-content with their travel options. So we understood that further information needed to be included to select more disadvantaged and low-income communities or people. So here we did an analysis considering income per capita, let's say, considering the household size. And that was key to determine people that maybe were in greater need because they had more people living in their household. And here we selected people from the final group, which is respondents that had less than $20,000 a year per capita. And we had a sampling frame of 471 emails. And we started sending emails in subgroups to have more control of the scheduling and getting the interviews done. So now to our actual data description of the interviews. So in total, we got 38 respondents. We got a response rate of 14%. We sent 269 emails. From that, we had 19 men and 19 women. The age groups were 10 people from the 18 to 34, 21 from the 35 to 64, and 7 people 65 plus. From this, we did find that several of our respondents had mentioned in their survey that they had some limitation in terms of driving or walking or biking. And this is coherent with the interviews that we were listening to, because several of our elderly people did manifest some of these issues. And also there were a couple of other people with disabilities that were from the other age groups. In terms of race and ethnicity, we see there is a greater proportion of white and Caucasian, but also here they could select multiple races in the questionnaire. But we do find that around half of our interviewees were identified themselves as Hispanic Latino. In terms of how their income categories were, we see that 11 of our respondents identify that their household has less than $25,000 a year, 18 less than 50, between 25 and 50 $1,000 a year. And from the first group, probably we got the rest of the participants of households between $50,000 and $75,000 a year, and then 2 participants of between $75,000 and $100 a year. Their occupation, we found that only 9 were full-time workers, 7 part-time, 3 self-employed, 6 mentioned they were not working, 6 were homemakers or caregivers. We also had several students, 3 full-time, 1 part-time, and 1 taking some courses. Know that some of these do overlap, so there could be students that are also working part-time. And in terms of occupation, once we checked at the responses of the survey, we find that only 4 were in occupations that could be remotable, and this is consistent with their responses later on, and then their response towards their nature of job. And so we do have several that were working in farming, in construction, in transportation, others working in cleaning and protective services of building, and also in personal care and services. So we do have, again, consistent to the results of Basar's explanation, that 9 of them identified that they can never work remotely because of the nature of their job. And also several of them have less options per week or per month, and the majority did not provide a response. So a little bit of how they live. So 25 of our respondents rent, 12 own a house, and 1 mentioned it was provided by others. The type of neighborhood, we had 16 that lived in an identified self-identified urban area, 19 in suburban, and 3 in small town or rural areas. And in terms of car ownership, 29 said they had a car, 9 said they didn't, and 1 leased. What type of cars do they have? So we can see that they have more or less 1 or 2 vehicles, because the third vehicle category is usually skipped by our respondents. But in terms of their type of fuel, most are gasoline and gasoline hybrid. And in terms of when they bought their vehicle, we did an analysis of year bought versus year of the model. And so the majority, the year bought is older, it's much greater year than the year of the model. So meaning it's very likely the vehicle was a used vehicle. So now in terms of the actual interviews and what they told us. So what are they doing in terms of activities? So several of them mentioned changes in terms of lost or changed employment, children being back to school in person, and that was a major change for a lot of the parents. Also, let's say retirees and homemakers didn't identify a lot of major changes in their activities. They did mention a lot of online shopping has increased, and they use this service more times. During the pandemic, more of that was focused in groceries and food delivery, but groceries has returned in person, while food delivery continues, and a lot of people, especially the elderly groups, did mention telehealth appointments too still being in use. And also sometimes products like in Target or Walmart or these companies are also some of the deliveries that they continue to use. And other things that they do mention is that they've been focusing on essential travel. So mostly mentioned working, going only for work or school and for groceries and health appointments, then some family commitments and church, but very much reduced or have no leisure travel at this point. Some of the quotes that we saw here were, everything was virtual, yes. Virtual learning, they with their school everything was shut down. So I was working from home and the kids were learning from home. Another participant said, I decided to join DoorDash because it has gotten me through the last couple of years, because since the pandemic, everything has changed since then. Now, everybody's ordering either, everything if you weren't able to go and order stuff. So I used to go to a movie at least once a week, and because of the pandemic, I stopped. This other participant said, so very different. My employment has changed recently, so that's certainly part of the impact. Before the pandemic, I was traveling, commuting, and to and from an office in the financial district every day. and I commuted by public transportation. Then the gig job that I have also kind of stopped or went online during the beginning of the pandemic. So either I did that or also at home, or I didn't do it at all. So these are some of the examples. In summary, also we asked them about their burdens and challenges, and we were able to see a difference between those living in urban areas and those living in suburban or rural areas. So for urban areas, most of them mentioned that they had well, good service of transit in quote unquote good. They did say that lower frequencies were identified after the pandemic. Some areas are low coverage or partial coverage, let's say, especially for non-commute trips. They do mention a lot the cleanliness as an aspect that is affecting them right now, and also personal safety, especially in the bigger cities like LA and San Francisco. In terms of walking, biking, and micromobility, they identify that they can do it and they do it more, but they are concerned with road safety here. And especially when mentioning biking and micromobility, they do say there's not enough infrastructure, and that micromobility is expensive for an everyday use. For car users, of course, the gas prices are always highlighted. They do say also congestion is a big issue and parking is a hassle. And ride hailing in general was highlighted as an expensive service, and that it is available, but they would only use it for eventual or occasional trips. So these people do have a greater variety of options, and they were identified as less car dependent. On the other hand, suburban and rural mentioned that for transit in particular, there was consistent low frequencies, very low coverage of all kinds of trips, and inconvenient routes to different locations. For walking, biking, and micromobility, road safety is in general, and that's because of lack of infrastructure, long distances, so not able to walk or bike anywhere, and no micromobility. So this is a big difference compared to the urban setting. Car users, of course, the gas prices, and they do travel longer distances, so it has impacted them more. Ride hailing is expensive, but also inexistent or very low provision. So they have to wait a lot, or they also mentioned the need of connectivity. Sometimes in rural areas, you cannot access it at all. So these, because of these issues, they were more car dependent. And some of the examples we had here, for example, public transit in urban setting, it was like, there's plenty of options around here. I guess my main concern would be safety. Another example is they were gonna make some changes to the bus riding atmosphere. It's really dangerous. Other mentions were in the rural or suburban areas. Sometimes it takes me like 3 or 4 buses, to get where I need to be. And that's just too much. There's public transportation. The public transportation system here does not reach every place that it probably should. There's a lot of industrial areas out here that the public transportation does not go to. For walking and biking, we have in urban areas. Well, I'm concerned about the scooters, because they would be riding on the sidewalks and stuff, where are people gonna walk? And within my neighborhood, I do walk. I have most of the things I need within walking distance, like groceries, post office, hardware store, park area. So that's easy access to most of the things regularly without needing any other form of transportation. In contrast, in suburban or rural areas where little is within walking or biking, I would like to see speed bumps around every elementary school. There are some already, but that look like an act of Congress. It usually takes a young child to get killed in a crosswalk. I would use the other forms of scooters or electric bikes if they had designated lanes or roads where you could ride an e-bike or scooter. So in terms of micromobility, we saw in urban examples. I didn't use them. It sounded like it was ridiculously expensive for not very much. I'm sort of scared of like the electric scooters with all the accidents that I've seen on the news. For non-urban, people own them, like people own their own, but not like in LA where you can rent them. And for ride hailing, we saw that in urban areas, they said, yeah, you can use Uber and Lyft, all that, if you have a smartphone. I guess I would rather be less expensive than it is. It seems to have gone quite a bit since the pandemic. If it was an urgent situation, then I would be like Uber, Lyft, or taxi. For rural and suburban examples, Uber and Lyft, I have never gotten into that. I don't even know if it exists here. I think that's one of those things that you have to be in a major city. And in general, the gas prices that we heard of, so the cost of everything has gone up, with gas, food, electricity, everything. There's no doing pleasure driving. Having the money to charge the cars, I mean, nowadays we all have credit cards. The main concern is probably gas prices. Hopefully none of the cars break down. I'm cognizant of the van because it's 8-cylinder, so it uses more gas. And there's also, like, in general, concerns of road safety, and people in this town don't reliably stop. There's lots of accidents right by the school, and actual driving here in Oakland, they drive so crazy. They're usually young adults, they get these cars and they just drive the way they want. Other things we learned about were how they were adapting to some of these situations. And so we heard about reduced frequency of social and recreational trips, reduced travel distances, let's say fueling strategies that they had of fueling the tank, etc. Carpooling with family and friends more often, Uber and Lyft for trips that were covered only by insurance or mobility card, and considered changing to more fuel-efficient vehicles. I'll just mention a few. So, for example, this one, I'll try to keep it minimum, so that I don't waste, but I don't go for like a Sunday drive out of the beach along the coast as much as I used to. I just don't do it anymore because, I don't want to spend 40 on a tank of gas. And the other example is, and we enrolled ourselves in like the fuel discounts and those type of programs to get a little bit of a break. They're cutting down corners, and using a lot of the credit card. Other things they used, like the carpool that I mentioned. So they were carpooling with a co-worker for a while. And then also doing groceries online has been also a way of cutting down transport. And so this person said, you pay $59 a year and you get all your groceries delivered. And so I joined that program and started having everything delivered to me. And then another person said, so basically I have a mobility card and I call us Lyfts. So because of these things, they've been able to use these services. In terms of new technologies, which we also asked them, so what they thought about the new technologies. And in general, for EVs and they just commented on the affordability. And so they basically don't afford new vehicles in general, and especially not EVs. They have concerns in terms of charging, household charging, especially because the majority are renters, so they mentioned that. And also not seeing like public chargers to be available. And a little bit, so less than the other two, they mentioned the range for longer commutes, but also like concerned that, this would also increase their electricity bill, which they feel already high. They do ask for more options for secondhand because they are mainly buying secondhand, and they are looking for mostly hybrid vehicles, so that will be something to consider. For other services that we asked them about, so we asked about Uber, Lyft, autonomous vehicles, etc. And they did mention the issue of some, especially the rural areas, were concerned about the connectivity. Sometimes they don't have internet in general, so how would they even connect to these services? Coverage for small towns and rural areas, affordability, as we saw, expensive, all of them, both micromobility, ride-hailing, they were all considered expensive, so they're only using it for urgencies or occasional trips. Road safety was a bigger issue with scooters and e-bikes, and a full distrust in terms of the driverless technology. They're still not trusting that. So I'll just mention a few of these examples. For hybrids and EVs, they are considered, they would say like, I would love to have, you know, an electric car, but we're retired, we can't do that. Or I would probably consider a hybrid vehicle so that I can get better mileage. And then in terms of charging, I just don't see any more charging stations. And then I heard about the rebate having, but I haven't gotten into. And also, since we rent a house, my problem is that wherever I can charge my car. Driverless or autonomous, this is like a general perception. A lot of them mentioned quotes like these. I see that probably another 10 years down the road before that's truly a safe option. Everything can malfunction, you know, everything, it's kind of scary. Everything could go wrong. I think autonomous vehicles are going to dumb everybody down to a point where they need to drive, that if they need to drive again, they won't be able to. And one person mentioned, but I mean, you know, that's buses in a way. So some of the things that we asked them is like for policy suggestions, like what if they could recommend anything for their public or decision makers, what would they say? So most of them did say they would like high quality local public transportation. This meant greater frequencies, greater coverage in space and time. So this meant like not only for commute trips, but different hours that are not just commute, and also places that are not just for work. Cleanliness and safety, especially in cities, was a big issue. And affordability for all. This was especially mentioned by the elderly and disabled that have a lot of difficulty getting around, and they depend on these services. So more discounts for this population. In terms of another aspect they were all recommending, well-maintained and safer roads. So pavement quality over more roads. They mentioned several that they are concerned with the pavement quality. We've heard a lot of the safer crossings for pedestrians and traffic calming, protected bike lanes. And in terms of travel time and cost, of course, congestion was still highlighted by several, but for buses and cars, they mentioned, and reduce fueling costs, however that is possible. So some examples of these could be the idea, I like the idea of public transportation. I support it 100%. I don't mind paying more taxes so that it is so that the infrastructure gets built and modernized. Help those that are disabled and those that are senior citizens to actually get around, actually work with AC Transit, work with BART, even if they couldn't do it for free, maybe just give like 50% off or 70% off, etc. I don't know, like there's no necessarily a solution for this, but I think that cleanliness and safety on all the transportation platforms is a concern for everyone who rides them. And for, in general, improving infrastructure and repaving some of the streets around here, which look like they're in worse shape than half of Gaza. Changing some of the routes in terms of widening something in roads, and also, but what would like be more important is fixing the potholes. Any place that I have cycled, I know there are a lot of dedicated cycle paths in San Francisco in terms of like practical purposes, but more dedicated bicycle paths is what this person was recommending. In terms of travel costs and time, the gas prices mainly is an issue. Try to control the gas prices, because one day is sort of affordable and the next day it bumps up. So it's very volatile and people cannot budget for it. But it also just congestion, and getting somewhere like my kid's school is only about 5 miles away, but it can take a lot of time to go 5 miles. Okay, so some of like the key findings to summarize is, so in terms of activities, these people are doing essential activities. They are stopped doing a lot of the leisure activities that maybe they were doing pre-pandemic, and etc. They are focusing on work, study, groceries, medical appointments, and some visiting family or church, but like very essential. Few respondents identified having flexible and hybrid or remote jobs. So this, let's say, option of not traveling is not necessarily an option for them. Travel challenges and burdens, we saw that that differs a lot from urban and suburban and rural areas, and each has their own particularity. In urban areas, we found more that are safety issues related to walking and biking. And let's say there is the option of ride-hailing and micromobility, but they are considered expensive and not affordable for an everyday use. And for transit, it's just like, yes, there is coverage, but also there is a problem with safety and cleanliness. And also sometimes the schedules are not for non-work or study options. What they want to see, in terms of suburban and rural, we do see they are very car dependent and have very low access to like all the other options. So right now, if the gas increases, they have no other option but to still spend money in their car. And in terms of what they really want to see, they all of them mentioned better and more transit, better frequencies, better coverage, cleaner, safer in general, and somehow maybe stabilize or have lower gas prices. Of course, that would mean maybe creating programs for them. For the other modes, it is important that maybe there are programs specifically for low-income communities, like for ride-hailing. They mentioned that they could use it when the insurance could cover it or where they have the mobility card. So that's something to consider in the future. And from road safety in general, we've mentioned these. So a few of the maybe final conclusion in terms of perceptions on new technologies is that they all need to be more affordable. And for EVs and such, it is important to consider that the majority of these people live in rental homes and they buy secondhand vehicles. So how is that going to work for them? And finally, there's a distrust in AVs, and still not maybe considering until maybe 10 years in the future. So we did a little bit of comparison with the California Transportation Plan, the 2050. We found that these goals that the California Transportation Plan has, the highlighted ones are the ones that mostly match with what we heard from the interviews. So safety, equity, accessibility, and infrastructure. These are people that are more concerned with their daily, everyday life and being able to go to work and do these things in a safe and affordable way. And so it seems like it's not that they're not concerned with the environment or other things. It's just like their priority right now are the essentials. Similarly, we compared some of the other recommendations, and we feel these are the ones that are more aligned with their current needs. So in summary, if we see like, yes, there is greater work right now and at least policies that are working towards more supporting transit, and the active transportation program is also very important to keep supporting for what they mentioned. Working towards zero deaths is key from what they were telling us. And the overall sustainable communities strategies is still should be still supported, especially for accessibility and having more options of work and essential services around people. And focusing on maintenance more than creating more roads is something they are identifying. Finally, the suggested improvements include somehow creating programs for local and regional public transit, not only, let's say, just not only thinking about the California high-speed rail, but mostly in local and regional public transit, creating programs for secondhand vehicles, and maybe cleaner secondhand vehicles. That should be something to consider. And finally, how to create more affordable and available options for shared services like Uber, Lyft, and micromobility. That is key aspect here. So a few limitations that we do think and future study that we could work on in this project is we do think that it is important to further work on using the geographical data, and that could be used further because though adjusting per household size was very important to identify key participants, the geographical component could be also very useful. Again, this is all to reach more disadvantaged communities and have more talks with them. They tend to not participate in some of these studies. So we still, even though we strive to find them, it's still hard to maybe find them and have their participation. And finally, even though we provided English and Spanish version, most of the participants opted for the English interview. And there is questions for ourselves, like how can we make this more accessible for all kinds of participants. And in the future, as we mentioned, we do plan to do some more geocoding to match our participants with the census tract zones identified in Callan virus screen. And finally, going directly to communities, carrying out interviews directly there or focus groups could be more useful since they don't maybe participate in these kinds of studies as much as we would like to. And doing analysis by age, disability, gender, and racial ethnic identification is very important as they are probably very specific needs for each of these communities. So thank you so much for hearing our study. Thank you for our project sponsor, the SB1. So now we open the door for questions.
Thank you so much, Carolina. We only have a very few minutes left for question and answer time. So I want to jump into the questions because we are getting some very good questions from the audience. And I want to make sure that we do some justice to at least some of them, some of those questions. So I will pick, first of all, there's a question asking about whether the final report of the study is available. And Carolina, I think you can briefly mention that we have multiple, I think, output research.
So we have an initial report already submitted, but we are publishing this study this year, so it will be available in a paper as well. So we would gladly share that once it's published. But yes, so this year we will have the paper and the report.
And that first version of the paper is now under review, so we will get the feedback and then issue the final version. There was a comment from a colleague in, I believe, from Caltrans, asking whether we find any desire for compact, sustainable communities in this work.
So they didn't mention, they didn't mention it specifically for compact, but they mentioned it in general, like they would like things to be more in walking and biking distance. So because they do say like they do travel to these essential places, and sometimes it takes them forever to go to these places, even though they they cannot walk or bike to these places because they're far away. Especially this is more for suburban and rural. So like when we contrast both, we identify that those in urban actually highlight the benefit of having these things close by. But in the other ones, they just mentioned it's really hard for them. Yes.
Let's jump to a methodological question. I see a colleague is asking, what was your experience using AI in working with a project serving priority populations? Do you think there was any biases or dialect challenges evident? And what do you think?
Well, AI basically helped us make.
Oh, I think we lost Carolina. I think we're getting a little bit of an internet issue here. Basar, do you want to answer that question, or maybe we move to the next one, and then when Carolina is back, she can answer the AI question?
Yeah, I can actually briefly talk about what Carolina was almost going to say. So the AI tool has been used mainly mainly to cover the transcription part. So it created the initial transcription, and then Maria, Carolina, and Vanessa, they both did the double check for the transcription after the initial one was completed. So as far as I know, they didn't identify any like dialect related challenges with the AI. It worked pretty fine. Like 95% of the time, it provided exactly what was expected, both in the Spanish and in the English version of the transcript.
Perfect. Thank you so much, Bashar. There's another question that asks about the small sample size. And so whether we consider in the study any biasness in the sampling, and also the fact that the sample size of 38 individuals that answered to the interviews is pretty small. And so can this be used to generalize for the whole California? And maybe I can mention briefly on this. I would suggest that in general, this is qualitative interview, and it's using small sample sizes. So it's difficult to generalize the results, but there is the possibility for this to get insights that are more in-depth from the interviews. Of course, the quantitative part of the study that Bashar mentioned, that is based on thousands of cases. So that one is much more easy to generalize to the entire population and to special groups of interest based on a large sample size. But then the in-depth interviews go into more the details, into in-depth topics. And I see Carolina is back now next to you, Bashar. That's great. The proximity of being in the same office helps. There's another question, and I hope one of the two of you can answer this. The question is about transit fares. And there is a potential here for being creative about the transit fares changes. And there could be possibility to think about lower monthly commuting fares to help individuals that are doing some remote work. And we can think about some local pass with commuter pass for systems with separate fares. We can try to address issues for hybrid workers, for people that travel not in very often by public transit, but can still benefit from certain type of negotiated fares for lower fares. Either one of you want to handle this question based on the findings from the study?
Yes. So I actually, one of the interviewees had an interesting response to this, let's say. He mentioned that he really appreciated when he was able to get a whole week of, let's say, 20 passes, because that helped him kind of get the discount enough and plan that he would spend specific money on that, and then he can budget for everything else separately. So those packages of like weekly passes was very useful for this person. Also, this person also mentioned that having capped fares per day was also useful, but that sometimes it didn't work. So that's why he preferred the weekly pass, because he would know he would just get that money. So people really want is to be able to budget things, not necessarily for the month, because they don't necessarily are able to spend $100 or something in advance, but maybe weekly passes are a good idea, so that they can budget for the week, and also being able to like determine exactly how much they can spend here. So I would suggest having that kind of grouping. Also, for hybrid workers, it would be a similar thing, just maybe having able to, maybe, you could get 10 passes per month, and as to a special discount, or, those things are useful, and that they know how much they're going to spend in advance. This is also one of the criticisms for gasoline prices, that they're very volatile. So people just want to be able to budget their things in advance and know how much they're going to spend in each of their essentials.
That's a very good point. Predictability and not having too much volatility of prices. Carolina, that's a very important point, also associated with the efforts in California with all the new integrated payment system for transportation, for public transit, potentially for new services in the future. So I'm sure the people, the colleagues in the state agencies and in the regional planning agencies are very interested in these topics to further discuss. I want to be careful with time because we are already 1 or 2 minutes over time. We still have more questions that were raised. I see also some of the colleagues that were attending the webinar were asking specifically some question about some slides, slide 40 and some others. But the recording of this webinar will be available and all the slides will be visible there. The material from the webinar will be also made available with the full presentation. So the colleagues can check the material in the slides, and also the report when finalized after the feedback is received and addressed, the peer review feedback. At that point, the report will be finalized and shared. So at this point, because of timing constraint, I would like to thank, first of all, the speakers. Thank you so much to Carolina. Thank you so much to Basar. Thank you so much to all the researchers that contributed to this project, the partnering agencies, all the CBOs that also assisted in the recruitment of some of the respondents. I also want to thank all the support team at UC Davis that made this webinar possible. Alejandra Soto, Michael Fortunato, JC Sanchez, all the other colleagues that have been supporting these efforts. They've been essential, and all together with all the communication team from the Institute of Transportation Studies of UC Davis, we really want to thank all of them for the great effort they make, actually our possibility to share our results with other colleagues. The recording will be available in a few days, and also the slides together with the recording. We will also make available the report as soon available. And in the slides, there are also the contact details of Carolina, Basar, and all the other members of the team. We'll welcome any questions, and you can feel free to contact the speakers for any follow-up question. With that, we will wrap up here the webinar. We want to thank all the colleagues that joined us today for this great session. And again, thank you to our speakers. And see you soon for another webinar from ITS Davis.